Well, welcome back to another episode of the podcast. Today, I have a guest, another obesity physician with me today. This is Dr. Dolapo Babalola, or Dr. Bab. Dr. Bab. She is board certified in family medicine, obesity medicine, and lifestyle medicine. She practices clinical and academic medicine at Morehouse School of Medicine, the Department of Family Medicine, as a professor and director of undergraduate medical education and family medicine and rural health clerkship. She is also the founding CEO of Living at Your Finest Wellness, a holistic practice that helps communities live at their finest by being empowered by the pillars of lifestyle medicine as the primary treatment and to nourish and flourish as a whole, vibrant, and healthy champions. She hosts the Living at Your Finest podcast, where topics address holistic approaches to achieving optimal health and wellness. She's a wife, mother of three, author of an inspirational book, adventure seeker, lover of God, and community builder. Thank you so much for joining us today.
Thank you. The honor is all mine. I really appreciate this wonderful opportunity to be in your midst. All the great work that you do. I follow you so closely. So thank you so much.
Well, thanks. Yeah, I mean, we have such complementary things we do. And I think we're both just interested in helping people live their best life, right? And there is a whole bunch of ways that we are doing that. I invited you on today to specifically talk about hypertension or high blood pressure, because this is a really common health condition that we see. And it is definitely something that we can do a lot with in terms of lifestyle. Of course, there's medications for it. And we'll talk about all that today, because this is something that a lot of people, if they are working on their weight and health, they may have experienced this diagnosis of high blood pressure or hypertension. So first, we did your formal bio, all the amazing work you do as a person and as a doctor. But why are you interested in all of this? Like, why is weight and health and high blood pressure, why is that interesting to you?
Yeah, so, I have always had an interest in just preventative care, just from a personal standpoint, family history of high blood pressure, diabetes, all the chronic diseases. And, that's why I went into medical school in the first place. Oldest of four kids, always a busybody, wanted to know what's going on, why is this happening, and how can I help my family, how can I help myself? So that's where it all started. And then as I went into medical school, realized that there was just a lot of bandages, right? So we learned about medication, which there's nothing wrong with medication, but how about taking care of why this happened in the first place? The way I like to look at it is that if the roof is leaking and all you do is just mop the floor and you don't repair the roof, you're just going to keep bandaging. So that was really where the interest. And personally, I struggled with weight issues. I had issues with my blood pressure. I was overly stressed, and all those reasons I realized that there has to be a better way. And so that's where the passion came from, to help myself personally. And then I had to get additional training that helped me figure out this is a better way in terms of maintaining transformable as well as sustainable lifestyle changes. And so that's where it all came from. And then of course it just pillared from there continuously to just overall provide quality lifestyle and quality health.
Yeah, I love what you said about we do a lot of band-aids in medicine and dealing with that leaky roof, right? Where we're like, we can keep, mopping the floor, but why don't we see if there's something we can do to stop the roof from leaking, right? Is there something we can fix? Is there an underlying thing that's causing it? And, anyone who's listened to my podcast, I believe in medications, right? I believe in medications to help with weight. You're going to sometimes need a blood pressure medicine. You're going to need a depression medicine. There is a role for all of those. But sometimes I'm sure you saw patients like this in your training and probably still today, we see people who are on 8, 10, 12 medications sometimes, and you take a step back and you're like, is there something underlying that we could fix instead of adding another medicine?
That's absolutely right. I mean, just in clinic this morning, I had a patient, young guy, 29 years old, and he was already on 3 blood pressure medicines. I was seeing him for the first time. And his question was like, how about adding a 4th pill? And I said, well, how about let's sit back and find out what the issue is? What's the underlying cause? And, I was glad that he was receptive to just having that conversation, because I think the awareness is where it first of all starts.
Right, right. Yeah, yeah. And, at a certain point, we do have a lot of different blood pressure medicines, right? But at a certain point, like, we have to use some of these other tools because we only have so many, right? Like we can do
That's
4,
right.
but like, we may not be able to do like 8 medications, right? For your blood pressure. At some point, we got to figure out what else we can do.
Yeah.
So let's talk about what blood pressure is, what high blood pressure is, what hypertension is. So we're all on the same page here, because I think everyone has heard that term, right? Everyone has heard blood pressure. We've all had our blood pressure taken, hopefully many times in our life. But I find most of my patients don't really know what the heck we're measuring when we do that. So how would you explain what blood pressure is?
Yeah, I think that's a very important question, and everyone needs to be aware of what it means to have high blood pressure, which is equally known as hypertension. So really that just means it's the pressure within the bloodstream, the blood vessels. Okay, so I always say, okay, all over the body, we have vessels, right? That's how blood is going to flow through and through. And the pressure, that is what we're talking about. If it is high, it's considered hypertension. Now we have different types of hypertension. Yeah, we have essential hypertension, which is pretty much what we're saying is there are risk factors that will lead to that pressure just being high. And then we have secondary, which will be something else, maybe genetic factor that might have led to it. So if I go back to the primary reason why you might have high blood pressure, they're modifiable, meaning that things that you can modify, and there's some things you can't modify, like age. As we age, there's a lot of things going on within that vessel, right, that is increasing the pressure. So it's like a hose, after you can't imagine having a hose that has been how many years, there's something going to happen there. So that's the same thing,
right? Like at 80 years old, our blood pressure is probably going to be higher than it was when we're 20,
that's
right? Like
that's
like that's just part of life, right? But at 29, like you said before, like, okay, like we should figure out what's going on, right?
That's right. So that's pretty much what high blood pressure means. And we go further into why is it high? What are the different types of high blood pressure? Now, I do want to stress that when you hear blood pressure, because I've had a patient say, why is there a top number? Why is there a bottom number? There's a reason for that. So the top number, which is called systolic, is just pretty much contracting. So the heart is contracting, right? And so that blood is pumping. And then the bottom number, which is diastolic, is just relaxation, right? So the heart is relaxing and it's emptying. So those numbers mean something, and we want them to be within a normal range, which we know is less than 120/80. That is considered normal. And then
120/80 is normal. So that's what we should all, most of us should probably be around 120/80. When do we call it hypertension? When do we say this is too high? We need to do something.
Oh, yes, absolutely. So between that normal and the hypertension is what we call elevated. And elevated could be, just I was under stress, I didn't sleep well. That is what we call elevated. So before we even get to hypertension, and that's usually in the 130s. But when we start getting higher than that in the 140s, then we start staging blood pressure. Now, to your question, when do we start doing something? Really as early as when you get into that elevated stage. So anywhere heading to from the 130s to the 120 rather to the 130s, and you start thinking, okay, something is happening. Because if you don't make any changes, it's just studies have shown that it's going to continuously get worse if you don't make any improvement.
It's not going to get better on its own.
It's not. If you keep doing the same thing over and over again, it's bound to get to stage 1 and stage 2 and what we call hypertensive crisis. So we don't want to get there at all. So that's why we need to be aware of what are those factors that would influence our blood pressure. And of course, as you can imagine, pressure, and this is how I show my patients, the pressure is supposed to move smoothly, but then it's hitting and it's damaging the linings, the endothelial linings, and of course leading to heart disease and other complications, stroke, and so many other.
So I think that's like one of the things, right? Is people, they know we measure it, they know it's important. Like, what are the problems that can happen from high blood pressure? Because most people like can't tell they have high blood pressure. Sometimes people might get a little bit of a headache. If it suddenly rises, people can have a headache, they could have a stroke or a heart attack or feel bad. But most of the time, people can't tell that they have a problem. The only way to know is to check at home or to have a doctor check your blood pressure. But it is doing things to your body when it's that high, even if you can't feel it. So what are some of those things that high blood pressure can be doing to our bodies?
Yeah, I mean, you absolutely said it. That's why they call it a silent killer, all right? You can have absolutely nothing going on and you have no idea. I've had patients actually in the 180s and not even have any, but that's unlikely when you start getting to the hypertensive crisis. But some of the common things that you might have is headache. I know that when I had high blood pressure about 15 years ago, it was headache. It was the worst headache. And I thought I was just sleep deprived. Didn't have any problems during pregnancy. It was a week after my second child was born, and I just had the worst headache. I felt this was not getting better. After 4 days, I checked my blood pressure. And I'm so glad that I even checked because some people wouldn't check. And I
Sure.
checked and it was 220 over 120.
Whoa.
Yes, it was that high. And so we always want to be mindful. Headaches, there's blurred vision. As you can imagine, pressure is pushing through the vessels, damaging the arterial linings. So you can have blurred vision. Some people can have dizziness. They just feel very weak and fatigued because everything is just in disarray because pressure is moving at a high level. When you start getting to the crisis level, some people can get confused. So there's several manifestations of high blood pressure, but the most important one that we hear a lot about is just nothing at all. So that's why we have to be mindful. If we have a family history or for our lifestyles or stress and all of that, you do need to keep an eye on your blood pressure and make sure when you go to your doctor that they tell you what their blood pressure is. Don't let them
Yeah, I
tell you
always
it's
tell my
normal.
patients, especially like my younger patients, my male patients who maybe
Yeah,
they don't have a reason they need to go to the doctor that often. I'll be like, you should at least get your blood pressure checked like once a year,
sure
right?
check.
Like if you do
That's it.
nothing else, even if you don't even go in for like your physical every year, like get that blood pressure checked because sometimes I see it's usually men, but people who come into the office, they haven't seen a doctor, gone anywhere in 10, 20
Mhm.
years. And I don't know how long they've had that high blood pressure and
Yeah.
it's been sort of like damaging their body. So let's talk about like, so some of the things that it does long term, right? When we have that extra pressure in the vessels that can damage our kidneys long term,
Yeah.
can put strain on our heart, increase our risk for heart attack and stroke. I was actually just looking at the statistic and it's like, I think it was like 30% of heart attacks are caused by high blood pressure.
Mhm.
So I always say like half of why I do what I do is like to prevent heart attacks, right? Like
Yeah.
that is something we can prevent and we have to treat high blood pressure to prevent heart attacks.
Yeah.
Dementia, like it can increase our risk of like, that pressure in our brain. It can damage our brain, and lead to changes there over long periods of time, right? So if
Yeah.
you have one high blood pressure, or it's been high for a couple of weeks, a little bit high, not that 220 like you had, but it's a little high, it's been 140, like you're not going to die, right? Like you're going to be okay if it's a little bit high for a little while. But if it's
Yeah.
a little bit high for like a really long
Long
time
time.
or
Yeah.
years or decades, then it
Mhm.
starts really damaging our bodies and putting us at risk. But your story is that like that hypertensive crisis, right? Where it was really high, it was actually kind of injuring your body at
Yeah.
that exact time, that point in time.
Yeah, and there are other organs that can be affected. You mentioned the heart, but then the kidneys, all that pressure in the kidneys, it can shut down the kidneys. There's also that effect where, unfortunately, because you're having all that damage to the endothelial lining, you can have high cholesterol plaques that form. And if it dislodge, it can go and cause strokes. Of course, the heart itself, because it's so high, you can imagine it's trying to overcompensate. There's too much load and work. So it gets bigger and enlarged, and that's where we have congestive heart failure. So congestive heart failure can end up leading to what we call pulmonary hypertension. So there's a cascade of things that can occur just because of the pressure in the vessels. So a lot of things that we need to be aware of and to arrest it as soon as possible.
Yeah. And so I think because we all have gotten our blood pressure checked, we kind of think like, oh, it's like this routine sort of thing, but it is actually such an important
Oh,
piece
yeah.
of health information. And again, unless it goes really high really quickly, most of the time people have no idea, right? You usually, most people can't tell that they have high blood pressure. And that's why getting it checked at least occasionally, I think is really, really important to health. I always tell people at their physical, like that's the most important part of
Oh,
your physical
yes, I agree.
exam is that blood pressure because we can do stuff about it. So we actually kind of made that sound kind of scary, which it is, but it also, like we said, it's not for most people, again, unless your number is really, really high. It's not causing emergent problems most of the time. It's not an emergency most of the time. Again, if it starts getting 180 or above, or you're having symptoms, headache, blurred vision, confusion, chest pain, then you always need to seek care. But most of the time, it's a long-term issue that it's causing. And so we have time to do something about it.
Yeah.
What is the relationship? So I talk a lot about weight on this podcast, weight and health. What's the relationship between weight and high blood pressure or hypertension?
Yes, certainly. So you see, when we have weight, just take a look at it. Imagine that you have the extra weight that the body is carrying that is not meant to. So I call like a space occupying lesion. So the weight is only supposed to carry so much, and then the more you increase, not only are you causing inflammation, right? Inflammation that will lead to oxidative stress, and imagine those oxidative stress causing damage to the endothelial lining. So that's the best way to describe it. Extra weight, extra inflammation leading to oxidative stress, and the vessels being damaged over a period of time. So that's why we find from the data that even if you just lose just 5% of your body weight, it makes a significant difference, because you're taking away that pressure that is continuously bombarding against those endothelial linings. And you have just again, like the horse that we talked about, you're not having that damage, continuous forceful damage upon the vessels. So that's the correlation. There's also, of course, we talk about insulin resistance. Unfortunately, with increased weight, you have that insulin resistance, you have the diabetes occurring, and all of that. There are three things I say must not stay in the same body all at the same time: high blood pressure, high sugar, and the high cholesterol, because together that just leads to multiple complications, and heart disease, of course, which is the number one killer, as we know, but for men and women. So that's the correlation. So we always advocate as much as possible, be within your healthy weight. We're not talking about a size 2 or a size 1. It's your own healthy weight for you, for your height, so that you can have less, minimal, all this metabolic problems that we're discussing.
Yeah, I think we talk about this a lot on the podcast, that small weight losses often lead to big health changes, right? So 5% weight loss often can improve your blood pressure along with lots of other medical problems. So it doesn't have to be getting to a normal weight on a chart somewhere. Any weight loss is likely to help your blood pressure. So 5% likely to help, a little more, 10% like going to be even better, right? So, we see small weight losses, and then it's about how your body handles it, right? Because I have people who come to my clinic and, they have 100, 200 pounds that they could lose, and their blood pressure is okay, right? So their body, they may have other medical issues going on, but their body's handling that. Yeah. Handling that. Right. And then I have some people who come in and maybe they gained 10 pounds and they're still not even overweight on a BMI chart, but their body doesn't seem to be able to handle that weight very well, and they have high blood pressure, and so weight loss for that person. And so this is just where, like having a medical professional get involved can be helpful, because everyone's risks and how their body handles weight is going to be different. And then sometimes people are a normal weight and still struggle with blood pressure, or sometimes they've lost the weight and they still are struggling with blood pressure. And there's a lot of other things we can do besides medications, which sometimes people also just need medications. But what are some of the other like big lifestyle things besides weight loss that we can see improve blood pressure?
Yeah, I love that you said that, because it's so true. I mean, you would have patients and I would wonder, I'm like, how is it possible you're normal weight, but your blood pressure is still high? We're struggling to keep it under control. You've done, or at least reasonable lifestyle modification. And that just takes us back to the etiology behind why the blood pressure is high in the first place. As I mentioned, we have what we call the primary essential. And that could be for several risk factors. Is it stress? Is it lack of activity? Is it diet? So is it, you just have to really figure out what the reason for that blood pressure is. So you could be within normal weight. Maybe you're eating healthy, you make, you move frequently, but maybe you're under a lot of stress. And now the reason why I had blood pressure at the time wasn't just my diet, but I was so stressed. It was, I had a 3-year-old with a newborn, and, type A, I wanted everything to be perfect. So I was overly stressed. I was in that cortisol overdrive for a long period of time. And, if you're in that stressful state, you have increased adrenaline and puts me in the fight or flight mode. So I'm constantly damaging my endothelial lining. So that is another reason. You could be normal weight, but you're overly stressed, and that is causing all that damage to the endothelial lining. So to answer the question, definitely, if weight is not an issue, or if it is, just pay attention to stress levels, to pay attention to sleep. That is something that we don't do enough of. And I'm guilty, and I'm constantly working on it, especially, this busy life that we're in. You have a family, you have work, you have kids. So we kind of cut back on our sleep, and that is not good for us, because when we don't sleep, we know that we cause a lot of dysfunction in our metabolism, not only with our sleep hormones, our hunger hormones. And one thing most importantly is that when we're not sleeping, we're not having that melatonin, but instead we have the cortisol, which again leads to further endothelial damage. Exercise has been shown to help. That helped me when I was blood pressure so high, and 3 medicines.
Yeah, I've definitely seen people where, kind of separate from weight, like they start walking 20, 30 minutes a day, and like blood pressure.
That was it for me.
Yeah. The walking, the exercise of some sort is really, really huge for blood pressure. Yeah.
Absolutely. So so those behavioral changes definitely help. So the exercise, all the other things that we talked about, and of course, certainly, the diets and just doing things in community, just really keeping in touch with your physician, making sure that your numbers are improving, that you're monitoring it, but not to the extent where you're overly stressed about it.
Right. Yeah. And for some people, their number is going to be higher in the office. We call that white coat hypertension, right? Where they're just stressed about being at the doctor's office and it's high. And so for some people, taking a blood pressure at home can be more helpful. But I have some people who that really stresses out. They don't want to do that. And so that, the office one is better if you don't like doing it yourself. One thing we didn't talk about either is it's really important to get an accurate blood pressure. So at least once a year, I have someone who comes from the dentist's office, and they go, the dentist said my blood pressure was high. And I'm like, okay. And, we check the blood pressure in the office, and it's totally fine. And there's a lot of things that can give us a false high blood pressure reading, right? So we could be really stressed, like maybe going to the dentist, which is stressful for lots of people. If your blood pressure is taken, on your arm over a shirt, especially a thick shirt or a sweater, it's basically useless. It's going to be a lot higher a lot of times. If your feet aren't touching the ground, if you're talking, if you need to pee, those can all raise it. And we want you to be sitting restfully for like at least 5 minutes before we check it, because your blood pressure is supposed to go up when you're stressed. It's supposed to go up when you're exercising. If you just walked up a flight of stairs to your doctor's office, it's going to be high for a couple of minutes, but it should go back to normal after a few minutes. So, we want to make sure it's an accurate blood pressure before we go ahead and say like it's a problem, because if you check it at home, you might find that it is high occasionally. And if it's high occasionally because you just had 3 coffees, or you just finished running, or you were really stressed, you got bad news, that may be okay if 90% of the time it's totally normal.
Yeah, and that's why it's an average, right? So it's not just an isolated blood pressure, right? You have to check it over a period of time, and you have to pay attention to how you feel your symptoms. And that's why you go to your doctor, they check it one time and it's high, they really will need to check it again and make sure that it's cooked. And some people have their machines where it's not calibrated. I don't know if that's something that you practice at your own location, but we have to make sure. I tell my patients to bring in their blood pressure.
Yeah.
We make sure it's calibrated.
Yeah, we double check it, right? Make sure that we're getting the same answer.
That's right. Make sure we check it. So there's all these multiple factors, but yes, we need to make sure that number one, we're taking it the right way, and we're using the right cough, and we're getting our numbers that is not freaking us out. And if it is high, let's figure out the next steps.
Yeah. Okay. So we talked about exercise is really powerful. Weight loss, even a small amount, is powerful. Yeah. What are some of the nutrition recommendations, sort of generally speaking, for high blood pressure? What are some, specific nutrition things that we know help high blood pressure?
Yeah. So there's been tons of studies that have just demonstrated having predominantly a plant-based diet. And it doesn't mean, that you have to eat plants completely and that's all. No, it's just being more focused in plants. And the reason why I say that is because that's where you get your fiber, that's where you get your minerals. And what we find is that you have that sodium and the potassium. You hear a lot of times when we say cut back on your sodium, but how much of your potassium are you even having? Because potassium will bring down your blood pressure, and you get potassium in your plant-based food. So
but we can't just like take potassium, right? That's not
no,
like a supplement. It doesn't work that
that's
way.
in
We
your
have to get
food.
it. Yeah, we
In
have to
your
get
food.
it from our vegetables and our fruits
Yes.
to get that potassium.
Absolutely. So that's where the primary, you want to eat more veggies, you want to eat your fruits, you want to have whole grains because you get your fiber from that. So all of that, and then cut back on processed foods, because unfortunately processed foods have higher sodium. If you looked at the box recently, the sodium could be 3 or 4 times. And what I try, because again, I have a history of high blood pressure, I've been treated for high blood pressure in the past, I pay a conscious effort to look at the box, and if it is 2 times the amount of serving size, then that is already too high. So you want to pay attention to what you're eating.
And you're talking about the sodium, right?
The sodium
yeah,
content,
so salt. And so a lot of times when we tell people, oh, cut back on salt because of your blood pressure, they're like, oh, I don't put salt on my food. Well, yeah, you might not, but if you're eating food that's made at a restaurant or food that's packaged, that food has salt in it.
Tons of salt.
You may not be adding any salt, but those do. And so we know reducing salt, reducing sugar, added sugars, which we just have a podcast episode about added sugars also. But reducing added sugar, reducing salt, eating more vegetables, eating more fruits, whole grains. And so a lot of times one of the diets we talk about in the medical world is the DASH diet is the most studied for that. So that may be a specific way of eating that has the most evidence for high blood pressure. And it's all the things you said, right? More fruit, more veggies, less salt, less added sugar, less saturated fat, which is mostly coming from animal products for people. And so, some of those really kind of common sense nutrition advice, right? That can fit with a lot of different eating plans where whether you're completely plant-based or not, you can eat that way and often have some improvement in blood pressure too.
Yeah. Now there are some additional things. Definitely you want to maintain the endothelial lining, right? So that you don't have breaks in the endothelial lining. You definitely want to eat more omega-3s because that will help healthy oils, healthy fats matter because that will help to maintain the integrity. So, if you're eating your fish, your sardines, that would go to all your flax seeds, all those great things that are anti-inflammatory will maintain the integrity of your vessels. Because again, as we get older, there's that tendency to have the stenosis, which we mean the thickening of the arteries, but you want to maintain that by eating foods that are nourishing for the vessels. So that's where you get your omega-3s and all those other great.
So fish can be a source. And then you mentioned flaxseed, which flaxseed is great. It is so easy to add to things. You can add it. You buy a big thing of it. It's really affordable. You can add it to smoothies, add it to yogurt. I add it to anything I'm baking. I just toss a little flaxseed in. You can actually use it as an egg replacer. Eggs are crazy expensive right now. So for like baked goods, you can use flax instead of egg to make things sticky. So yeah, flaxseed, I don't think we've talked about on this podcast, but a great power food and has those omegas.
Yeah, that's exactly how I use it. And sometimes I put it on my salad. It just depends, but definitely looking for opportunities to add. And some people say, oh, I don't like fruits and veggies, but you can find fun ways to incorporate it into like soups, your saute and things like that to just enrich your food so that you protect your heart.
Yeah, you don't have to like every vegetable, right? But if you can find a few that you like, you're probably getting the benefit if you're eating even just a few same types of vegetables over and over again.
Yeah. And then one more thing about nutrition, though, what we drink matter because we haven't said much about what we drink, right? So the alcohol.
Yes.
When I found out how much sodium was in there, I was like, really? I thought it was just sugar. But yeah, so we do need to pay attention to what we drink, not to drink our calories. And that's just so important. The juices, the alcohol.
And alcohol, even separate from calories, is known to increase blood pressure. So we really recommend not doing any heavy drinking, but for men, no more than 2 drinks on average a day, and for women, 1 or less a day. If for health in general, but for blood pressure, and that's a change that I see my patients make, and sometimes we see a big improvement in blood pressure. Some people are much more sensitive to alcohol than others when it comes to blood pressure. Caffeine can raise it a little bit, but I don't think we have any formal recommendations that that people should limit caffeine. But if that's something you're sensitive to, then that may be something that your body needs to stop. And okay, we didn't talk about one thing that's really important, because like, I feel like it feels like a given, but smoking. Right?
Oh,
Smoking.
yeah, that's right. Smoking is also, oh goodness, you're absolutely right. That's going to constrict your vessels. So pretty much just look at it this way. Anything that's going to constrict your vessels, make it so tight and damaging, and smoking will definitely do that. I'm glad you brought that up. So paying attention to
I
that.
have one of my early podcasts on like the 5 things you should do before you try to lose weight. One of them is like quit smoking, right? Like smoking is one of the hardest things on our body. And so always like good general recommendation if we're working on our health to quit smoking. And it's hard to do. So, you may need a physician who can help you. There are some medications that can help. But quitting smoking, if you have high blood pressure, can reduce the blood pressure and also reduce the risk of a heart attack from blood pressure that those two things have together.
Yeah.
All right. Well, I feel like we covered a lot. We talked about what blood pressure is. We talked about, a lot of different things we can do nutrition wise, exercise, watching sodium, watching alcohol, quitting smoking to improve our blood pressure, reducing stress, which is really, really huge, getting good sleep, and that modest weight loss, of 5 to 10% that can be really, really helpful. Before we wrap up here, is there anything else you want to make sure you share about weight, blood pressure, anything else that we didn't cover today?
Well, the whole essence of this, just educating our community is just so that people are aware that it's treatable. Because I hear patients tell me all the time that I have to live with this for the rest of my life. I want you to know that it's treatable, and it just because it's a genetic component, that it does not mean that you're bound to be on multiple medications. That is just part of you getting older, is part of the society. I want to, debunk that as long as we're able to make those changes, and again, like, as you already mentioned, it's not easy, but when you partner with your physician, it is possible to prevent, to treat, and even reverse in some cases. When it comes to genetics, it could be there, but again, somebody's going to have to pull the trigger. So your lifestyle will definitely
right. You have the genetics, but then the alcohol or the salt or the weight gain or the lack of exercise, like those things kind of add to those genetics. But I do occasionally have people, they do all the right things, they still have high blood pressure. And so, there's always a role for medications too, right? And you might do both of those things, right? You might be on one medication, but also cut back your salt and alcohol and work on weight loss, right? Like you don't have to pick just one thing. You can use all these things together for our health and for helping our blood pressure. Well, thank you, Dr. Babs, so much for joining us today. If people want to get more information from you or see you as a patient, how do they find you?
Yeah, so I'm in Atlanta, Georgia, and I'm actually transitioning into opening up my own direct primary care. So if you're in Atlanta, Georgia, and you live in the Marietta East Cobb area, I would love to be your direct primary care physician. I provide holistic approach. I do the medications. I also talk about the lifestyle habits. So I would love to be your physician. So my website is called livingatyourfinest.com. So please check me out there. And how you can reach out to me, I am Living at Your Finest Wellness on all social media handles, Facebook, Instagram, and I would love to connect with you and be part of your, health journey. I always say that we get healthier together, right? Because we are on this, no one has figured it out, right? We're continuously learning and growing. But I want to thank you for allowing me to be part of your podcast and having these great conversations, because we know that hypertension affects over 1 million people and it is the #1 cause of heart disease. So we need to keep having these conversations so that we can just get healthier together.
Absolutely. Well, thank you for joining me. I'm going to make sure that stuff's in the show notes so people can connect with you, especially if they are in the Atlanta area and are looking for a fantastic primary care doc. And with that, until next week, take care.
Thank you for listening to the Dr. Francavilla Show, where we learn about all things related to weight and health. If you love this podcast, make sure to leave those 5-star reviews and share this podcast with a friend or loved one. If you have a topic about weight and health you want me to tackle, head over to the website, thedrfrancavillashow.com, to submit your question. And make sure to subscribe to the podcast so you don't miss next week's episode. Take care.